I'm Dr. Peter Shea, and I'm the Chief Medical Officer here at Backus, and I'm joined by Dr. Setu Vora, who is one of our pulmonologists,
Hi.
and Dr. Tim Sullivan, one of our pediatricians. And we're here to talk about H1N1 flu, which we all know as swine flu. It's been around since the spring, and now we see a reemergence. And Dr. Vora, can you give us some of the history of the virus?
It's pretty exciting. This seems to be one of those instances where it comes out of so-called nowhere, and it gets labeled variously as the Mexican flu just because it came out of Mexico. But the origin of the virus is fascinating, and the French researchers looked at what made the virus, and they found 4 different components, including swine, bird, and human parts of the virus. But it's not new to us from the current pandemic perspective, but there have been previous instances where the swine flu has been around. This was amazing because it started out in April in Mexico, and the spread was just like wildfire, especially with the jet commercial airline travel. It really took off even to Australia and New Zealand.
What's different about this virus compared to the normal seasonal flu? Does it hit different people? Does it act differently?
It's a little different, right, Dr. Shea? The typical group that we worry about would be, our elderly folks and the young ones for the seasonal flu. For some reason, and most likely it's because of prior exposure to a similar virus, our senior folks above age 65 seem to have some remaining memory of a prior infection, and they are more resistant to getting the virus. Having said that, once they do get it, they are at higher risk for complications. So that's the only obvious difference, and that's why CDC does not put our seniors in the first high-risk group of getting the vaccine.
Our young adults, particularly the ones at college, and are at high risk. We've seen some of that with a lot of the local colleges, some of the colleges down south and out west have had lots of H1N1 on their campuses already.
We had the Coast Guard cadets with an outbreak locally as well.
So, Dr. Sullivan, what are you recommending to parents in terms of vaccination for their children this year?
Well, it's a two-step approach. We're certainly recommending the seasonal flu vaccine right now. So all children 18 and younger who are older than 6 months of age should get the seasonal flu vaccine. So we started to do that. And then probably in the second week of October, we'll receive the H1N1 vaccine. And we will also vaccinate the same sort of group for the H1N1 vaccine, flu.
And my understanding is that pregnant women are another risk group, Dr. Vora.
Absolutely. Of the mortality that we've seen, pregnant women stand out as one of the high-risk groups. So yes, they're definitely on the list for the first to get the vaccine when it comes around.
It also seems that if you vaccinate a pregnant mom, you may actually protect her unborn baby. So there's benefits to both the mother as well as the unborn child to get a flu vaccine.
For adults, the vaccine is just, we're looking at pregnancy and younger adults, and then some adults with chronic medical conditions and healthcare workers, and those are the basic groups.
Those are the main,
for adults.
Yes. Yeah.
Also, the families that have a young child at home. If you have a young child under the age of 6 months, those individuals in that household should get the H1N1 vaccine to protect that young infant.
Mm-hmm.
Correct. What other information should we be giving parents or patients?
Well, I think a common sense approach is probably the best way to begin. Good hand hygiene, reinforced hand washing, good cough etiquette to cover your mouth to prevent the spread of germs, and I think the schools are doing a nice job of reinforcing all these common sense approaches.
And staying calm and not be driven completely by the panic. The unknown part of the current H1N1 is what I think is driving the preparation and the media frenzy as well.
How bad will it be?
We just don't know. It's an unknown quantity. But the next few months will give us a better idea.
Right. And I think that's a good point, to stay calm, because although we think we're going to see a significant spread of this H1N1 virus, it is a fairly typical influenza, and for the vast majority of individuals, a relatively mild infection. So staying calm is the important thing. In terms of vaccination, every year we deal with sort of the myths about vaccination. Can I get sick from the vaccine? Will I have other problems? What's your opinion on those kinds of ideas?
I think there's ample evidence to suggest that you do not get ill from the vaccine. And people who have anecdotal experience of they got the vaccine and then became ill, it probably was not related to the vaccine. The vaccine is safe and effective. So those stories are probably more myths than truisms.
Absolutely. It's an inactivated or killed virus
Correct.
vaccine, so it cannot transmit the influenza as we
Right.
know it. But there are other strains of respiratory viruses
Correct.
out there. You know, it's easy to catch another type of common cold and feel as if the vaccine is to blame.
Correct.
So,
Has the hospital done anything special to get ready for this particular virus?
in keeping with this flu pandemic, we have an emergency operation group that convenes at Backus on a weekly basis. Dr. Shea, you're spearheading that that one as well, along with Nick Sanuda and a lot of other people on board. And it goes into looking at what our preparation is in terms of stockpiling masks, gloves, protection, medications, how to deal with sick inflow of more people coming in, how to deal with protecting our own staff who are taking care of these sick people, and serving as a great role in providing health services outside the hospital as well, if that's needed.
There are antiviral medications now for influenza. Who should receive medication and who should just stay home with the flu?
I think for most individuals who have mild flu symptoms, staying home is the way to go. Not going to school, not going to work, staying home until you are fever-free and better is the way to go. There may be a small class of individuals who might benefit from the antiviral medications. It's a little unclear right at this moment which individuals would warrant that therapy. The CDC is kind of working on some strategies, but they're effective, but only in sort of modifying the illness and shortening the duration of illness.
By a day or two at
Yeah,
best.
right.
However, having said that, for people in the higher risk category, if somebody's pregnant or if they have underlying severe emphysema, liver failure, and they get influenza H1N1, there may be a role in offering these selected group of people antiviral medication which go by the name of Tamiflu or Relenza, because that may possibly limit the aggressiveness of the virus. However, we just don't know the data yet.